So from the consumer perspective, consumer control and determination is number one on their list. And we've had various focus groups and discussions with our members around these issues. So I think I'm somewhat adequately representing them. Reduced need, I actually am going to do that. Reduced need to repeat information. Our members are really sick of having to, I think from the PVA, you brought that comment of just a snapshot of who I am. So they don't have to tell every person they see, especially if they have a speech impediment, or especially if they're really in bad shape right then, to have something they can hand over. Now that isn't every piece of health information about them, but it's real targeted because the health professional is receiving it. It's not going to read every piece of health information either. So transparency is very important for them for informed choice and decisions. Transparency to them. They don't mean transparency to everyone else necessarily. And the consumer ability to track information and progress. The fears, abuse of data by government and in the insurance industry. That is phenomenally large. And loss of privacy, though I'm repeatedly shocked. I've been a healthcare professional for a few years, and it's not about, I don't want you to know about my business, because people with disabilities, as they laugh, everyone knows about my business as it is. It's more about your having the information that could be used against them. So it's not so much about a privacy issue, it's about a potential for abuse issue. And I keep bringing this kind of language forward because I think it's really important that in the design phase we understand the experience of this. Difficulty to access and use. We work with people on Medicaid. They live on not much money. As far as we're aware, and we ask frequently, we think around 25% of our clients have access to the internet on a regular basis. That's not much. So just simply getting access is one, but then the interface with the system is another major barrier. And accuracy of information. You'd be amazed the misinformation that gets in there. And that's not about confusion about medical, about someone's file getting into someone else's file. It's much more about inaccurate judgment based on inaccurate information.